Health Minister Carl Hood has promised to have an investigation carried out over the circumstances surrounding the death of 2 persons in the last 2 days. The deaths were unrelated. However, relatives believe that if healthcare practitioners were more responsive, heartbreak could have been avoided. GBN's Trisha Ruben reports.
What went wrong? That's the question the family of the late Tasha Hood is asking the medical practitioners at the General Hospital. There are claims that a 34-year-old from River Road in St. George's bled to death after she delivered a baby girl last Sunday at the General Hospital. Her fiancé, Kelly Ruben, was present during the delivery.
Basically, my girl made the child about 9 o'clock in the morning, and I was there and everything was fine, and she, we talked and we talked about good days and thing, and then we went back. I went to hold the baby, went to the bed, she sit, and then a few minutes after she went up on the bed, and then she started to bleed and stuff, and then basically she tell one of them, they used to tell her about the nurse, and basically I find this is nonsense. I went and did lost some food and thing for her, and then she just when I came back, everything was okay, everything was fine. I left and went home. Before I even reached home, I get a call that she passed out in the hospital. By the time I reached back there, she was dead.
Ms. Hood was a member of the national netball team. Her sister, Patsy Hood Robinson, and father, Michael Nelson, are calling for improvements in the delivery of health care at the General Hospital, failing which they say more lives will be lost.
She didn't have to go the way she did. When I look at her yesterday, she was so pale. She looked like she lost so much blood. She's not like brown, she's like white. I don't know why these people in the hospital have to do this. I think they should be more careful. I mean, so much babies are dying. Her daughter had to grow up without her mom or other children. They doesn't understand what's going on. We doesn't understand. The hospital can't even tell us like what happened to her on that day after she had the baby. Her boyfriend came up, he told him that she was bleeding. The doctor was on their watch. They didn't even call the doctor to tell the doctor what was going on. And then they just let the girl just die just like this. I just don't understand.
Well, I'm very, very upset, because I visited her on Saturday and she was very healthy. She even hugged me, she told me she loved me, I tell her I love her. Up to now, the family is very upset about it.
In other news from the hospital, a mother of 5, Paula Bagwan Purcell from Vincent St. David's, also died under circumstances which have resulted in fingers being pointed at the General Hospital. Family members say that when she became ill, they called for an ambulance. Her father, Kenneth Bagwan, said that the respondent informed them that they do not extend that service to the Vincent's area.
She got home in good health and everything, and at about probably 9 o'clock, she had a slight headache, like a pain at the back, and she told her husband about it, and he gave her a little massage, and she felt a little better. So that was about probably 9 o'clock, and they turned in, they went to bed, and probably about 1 o'clock or so she got up, maybe with this a fits like, and he tried giving her some attention like, but she wasn't responding to anything. Called the hospital, and when the response he got was that out of the way that the ambulance don't go all that far, so he'll have to try and get her down how he could. But they have 5 little children that they had to get somebody to come to take care of, put them by the neighbor or whatever, and get help to put her into the vehicle to bring her down. Well, I don't know. That this is not good news for us. It's not good at all, because to begin with, it's a pain concern. They're not doing it free. And I mean, I don't see how they could have said that here's too far, because the ambulance usually pass here going further up to bring people to the hospital. I don't know if it had the morning there, they didn't have a driver. I don't know what the case was.
Our news desk asked Minister of Health Carl Hood about both incidents, and he has announced plans for an investigation.
Every death that takes place at the hospital should be investigated. There should be a reason for every death. And so we are going to go through the procedures of investigating that. Apart from that, I would not like to say any more, because I think persons must be given the freedom to mourn, the time to mourn, but we are definitely going to investigate it. It's very unfortunate. The other incident, again, is another unfortunate incident that happened Saturday evening. Matter of fact, we've had some problems at this point in time in deployment of ambulances and how the staff is rotated. We are looking into that. We have said that we want to have a national ambulance service, and somehow we are having some problems to get that running. I have an idea as to who's causing the problem or how some of these problems are caused, but again, it's not something that I would say publicly, but we are working on that.
Trisha Ruben, GBN News.